between man and woman is to be enjoyed to the fullest, especially when one is totally in love. However, sexual dysfunction such as ejaculation disorders, difficulty in having orgasm, erectile dysfunction, pain and discomfort can mar this experience, which could even lead to relationship breakup if not treated and looked at very, very, very well. Now, in the studio to help us with this discussion is a well-versed doctor. He's into so many things. He is a Dr. Richard EGHAN, a medical doctor with the Nature's Green Medical Center. Hi, Doc. Good morning.
Good morning.
You're warmly welcome, sir.
Thank you.
How's everything?
Not bad at all.
Right. Now, this topic we're treating touches the roots of people. It's really affecting so many people, and some people are even so shy to even come on and talk about it, let alone go to the hospital to get treatment. So let's start by scratching the surface. When we say sexual dysfunction, what do we mean?
Okay, thank you very much for having me on the program. Sexual dysfunction is actually a dysfunction or a problem that occurs with sexual intercourse. So we are talking about anything that occurs during the sex cycle process, or the sexual cycle process. And when we talk about sexual cycle, we are talking about the different phases, like for instance the excitement, arousal, then we are talking about the orgasm, ejaculation, orgasm states, etc. So there are different cycles that we go through when we are having a sexual intercourse. Anything that occurs during that process is actually meant to be a dysfunction. So anything at all within that process, because having sex or having a sexual intercourse, it's not just a simple process, it's a very complex thing. It involves a whole lot of things. It involves your mind, your heart, the entire physiology, the body functions, the body's biochemistry, everything. So when it comes to sex, it's just everything about you trying to gain some satisfaction from something that is meant naturally to give you some satisfaction. So if anything occurs in that process, then there is a dysfunction somewhere.
So both in the male and in the female, it is said that you meet, you have intercourse, and you produce. And those who are very in tune with religion also believe in that a man would have sex with a woman to produce. I mean, you produce offsprings and all that. So the question then happens that if this is supposed to be happening, and for me, I go into a relationship or I go into a marriage and I'm set to be barren, I'm set not to have this, or I have something that's causing something, it affects the person. Why is it so? What is it? Would you say is genetical to that particular person? Could it be a family disease? Could it be what would lead to that dysfunction?
Well,
let me say, what are the causes?
Okay, so we are talking about dysfunctions such as hyperactive sexual desire disorder, for instance, which is about, in terms of statistics, women have about 43% of it, men have about 20-something% of it. So we are talking about where one has a low level of sexual desire, libido, drive to have sex.
What would cause that low libido?
Good. So low libido, like all the dysfunctions that occur within the process of sex, most of it, which I'm very glad you've raised the causes, comes from the nervous system, the brain. Because everything starts with the brain. The brain controls everything in the body. So sex itself, the excitement itself, the desire itself actually starts from the brain. What you see, sometimes they say what you see is what you get, and it is true, because what I see, what I want in a woman, that is just the beginning of the process. And then after that, after I've seen what I want to see, first of all, then the brain starts to inform the rest of my body by sending signals, chemical signals. Neurotransmission in the brain will take place by sending some signals, and then hormones. So we are talking about neuroendocrine, aspect of sexual, function and dysfunction. So when one is actually excited, all these activities, because you have seen, so sight comes in, the sense of sight or seeing comes in, and then all this chemical information will be sent to all the parts of the body, including the heart. So the heart will start playing its role by trying to pump some more blood into areas, the erogenous areas or the excitement areas, and all the reproductive system, everything into all the anatomical structures. Then the blood pumps in terms of a man, it pumps into the penis or the penile tissue, and then the erection will take place naturally. And in terms of a woman, it also goes into the the clitoris, which also erects. So a lot of activities are going on whilst you are not even aware of what's going on. So at any point, if something happens at any point, then the whole process actually, goes, a nosedive straight away. Everything go, pear-shaped straight away. So yes, the causes are mainly neuro, that's the brain, endocrine, that is the hormonal, anything to do with the hormones, or the heart, which is the cardio, or the vascular, the vessels. So it's a very complex thing.
It's a very complex thing.
It's not a very straightforward thing. Now, if someone is having any of these problems, like hypoactive sexual desire disorder, for instance, which is actually very common with our sisters, the women, it is not necessarily genetic. And you said something about barrenness and not having a child. In fact, sex is not always, and I just have to explain this point. I have to be very explicit on this. Sex is not mainly about wasn't actually meant only for reproductive means, etc. It is also for pleasure and excitement. But one of the things that human beings enjoy on this planet is sex anyway. All the toils, all the labor, all the things we go through, it is mainly for some of these things, and sex is one of those things. So it is not, and I would say it is not. Once upon a time, we used to think that, when you meet someone, just wait till you meet the person, and when you start having sex, the major focus is just about having children, and that's it, don't do anything else. So people only were used, especially women, were only used as object of sex, and they just have to produce children out of sex. That is not what we have today. Civilization has taught us that it is not the case. If you are not able to perform sex, and if you are not having the excitement to have sex, it is not a genetic issue per se, as you try to ask. It is actually a lot to do with hormones. If it is a woman, we are talking about things like hormonal imbalance. So if estrogen and progesterone, which are the major women hormones, actually are not balanced in a certain way, the ratios are not good, it can affect the desire, which is just the starting point. Everything starts from somewhere, and if you don't have the desire, then you are in trouble. So hypoactive sexuality.
So it is those hormones and neurons that trigger the desire.
That is what triggers it. So it starts with, so most of the time when like for instance, someone came to my clinic in London. I have one clinic in London and one here in Accra, which started just recently. And I decided actually to start this clinic here because when I come here, I go to places like here or other places where people try to ask me questions. Apart from being an integrative physician and also having specialized in bioregulatory medicine, functional medicine, clinical nutrition,
and the
psychotherapy, I believe I decided to actually have an office here, so that it gives people the opportunity to come to see me whenever they want, and then we talk about anything. So in the London office, someone came to see me and told me he's not performing at all. He can't just perform. So he was actually having erectile functioning problem, or in other words, erection problems. I went into the issue, I psychoanalyzed this person, and we did all the tests. What we found was actually not an organic problem, like any organic aberration in the body, any part of the body, such as anything to do with diabetic neuropathy, which can also cause that. We'll come to that. So, hypertension, which can also give rise to these things. We realized that his problem was actually a psychogenic problem. It was actually psychogenic related problems. So why? He actually related this to me in confidence, that whenever he wants to have sex with the partner, what actually comes out is the partner will reluctantly accept to do it. And sometimes some of the things she will say before even she start, or she may even give in to do it, let me put it that way, give in to do it, is, in fact, there has to be a lot of persuasion to even allow her to give in, put it that way. And in the end, the words like that she may even utter, like, just come and do it quickly and let me just have some rest. Because she's been tired. In our part of the world, it's not that simple. It's not that simple at all. People wake up very early to go and come very, very late, etc. So when the person comes home, the last thing that is on the person's mind is to go and bath and open up for the partner to come in and do.
So your psyche in itself can cause that.
Exactly, because much of it.
If you're not ready, you're not ready.
When you're not ready, because when we talk about sexual dysfunction, in fact, you would say that the biggest part of the problem, the biggest source of the problem, comes from the psychogenic sources. In actual fact, if we have to talk in terms of percentage, I would say 60% comes from the psychological part, and then the 40 comes to physiology, anatomy, and the rest of those things.
So, Doc, if we're looking at dysfunction, and there are cases where, like you're rightly saying, but in this case, the woman, some women are not just excited. You will do anything you want to do, any kind of foreplay, any kind of whatever. They are not just excited. They're not moved. They don't reach orgasm. They're just not excited.
Exactly.
Is that a psycho problem?
It has something to do with the psycho aspect.
Or experiences or something?
It is a whole lot of things. When it comes to these things, what you just said, the hormones also come in a lot. Especially if the person have just had a child. 3 months, after childbirth, it's not very easy for them to, psych themselves to go in for sex. It's not that easy. The hormones play a major role, like I said. And sex itself, when it comes to sex, excitement and all these things, it's a neuroendocrine problem. So endocrine problem.
So Doc, to help our viewers and all those who are watching us, now at what point in one's life that you realize that, okay, I don't get excited. I meet a woman, I don't get erected, or I get erected, but after a few minutes it's gone, and all that. At what point of that dysfunction should one quickly go for medical treatment?
In actual fact, if you are a man watching this program right now and you're having any of those things, right from the excitement or sexual drive, libido level, to ejaculation level, and to orgasm level, at any of these points, you still have to go and see a physician or a specialist to deal with it. You see, when you are facing, like what I said, a hypoactive sexual desire problem, it's a big problem. And that in itself can drive, you down the hill. You see what I'm saying? That in itself. And if that doesn't, and you manage even to get a little bit of erection, and I'm talking about a little bit, if you don't get ample erection, certain amount of erection to enable you to go all the way, get in and do what you have to do. Because remember that you are not doing that to satisfy yourself alone.
Yeah.
If you're a man, you need to listen to this very carefully. You are not doing this thing to satisfy only you. Okay. That is selfishness. And selfishness in sex is just wrong.
Yeah. So
you have to think about the other party. If you think that you're not satisfying the person to their utmost best, this thing, then of course you are not actually doing anything.
Okay.
So if you're a man and you only do sex to just satisfy yourself, and those who only satisfy themselves are those who actually have the premature ejaculation. Within split second or 2 minutes or less than even a minute, he's come. He's got his, dispense whatever it is he has to. And that way he gets a satisfaction and the woman doesn't get anything at all. So that is selfishness, I would say. So if you're a man and you are facing that problem and you think it is normal, but then like you mentioned the cultural aspect, someone thinks that, so what, I did it and I've ejaculated. I've given you orgasm, I've given you sperm. The sperm is just going to make a baby, so why do you worry? No, that is not true. The sperm doesn't necessarily have to have babies, So women who have even had menopause, once upon a time people used to think that, after menopause, because you're not actually going to have a child anymore, you don't need to have sex. That is also wrong.
It's wrong.
You see, we have to treat sex as a very special thing.
Okay.
We don't have to shy away from talking about sexual problems. Many people actually shy away from talking about.
Sure.
So if you're a man and you are facing sexual desire, hypoactive sexual desire problems, you have a problem.
Okay.
If yours is not psychoactive sexual desire, it is something to do with ejaculation or premature ejaculation, that is also a big problem. And you might also have orgasm problem. You may even feel pain when you are having orgasm. Some men even feel pain. That is also a very bad thing. Okay. And then we go to our sisters too. If you're a woman and you're having the same thing, like for instance, the hypoactive desire, it's a big issue. And this is what you were trying to say. If the woman is not excited at all, we call it frigidity. We need to investigate what is going on.
Okay.
And before people start buying things, and I say buying things,
I was going to come to that.
Yeah, I know you will.
Yeah.
Because it is a very, very serious issue. Self-medication on these issues. You see, so excitement, when it is not coming, brother, sister, you need to seek advice. You need to seek medical attention.
Okay.
You see, because we don't pay much.
There's help for this?
There is help for this. Yes, of course. Dr. EGHAN, I have actually done a lot of research in this area, and I know very well that it's not just an ordinary thing.
But sorry to cut your thoughts, but apart from the Dr. EGHANs and all that we have around, are there specific doctors one would have to see, or any general medical practitioner we can go to?
In actual fact, it's first of all, it starts with the general practitioner.
Okay.
And I know every doctor that is worth his salt actually knows something about these things we're talking about.
Sure.
But they're very, very important.
Sure.
And you go to study some of these reproductive system problems, sex problems. All these things are part of, sex or reproductive system biology. So you learn some of these things, whether you're a specialist or consultant or a general practitioner. So it starts with them.
Right.
If you see, we are saying that in order not to cause yourself any harm, we will say that if you at any point, like you are saying, at any point, these things happen. It happens to many. Actually, when you take about 10 men at the moment, 10 men, you can have about 8 of them, 8 of them that are having these problems, and they don't talk about. And because they don't talk about, doctors also don't really talk much about it. They don't ask them or anything. But if people were talking about these things, of course Ghana would be having a lot of sex clinics and whatnot to deal with these issues, because people are committing suicides as a result of these things.
Sure.
So therefore, when you share the problem shared, as British will say, a problem that is shared is problem that is halved. So, or solved anyway.
Yeah.
So we would say that excitement is very important. When I look at what I want to see in a woman, I want to feel excited. Then the drive follows. I become aroused. All these processes are taking place. So first it starts with what you see.
Okay.
What you see, please, that is very important. If what I'm seeing is not good enough, then there's a problem.
When Doc, when you say what I see, what you see,
yes.
what do you, what are those things that are to be seen?
Good. Most men have some particular things they want to see in a woman.
Okay.
For instance, we're talking about breasts.
Okay.
We're talking about, these are areas that a man sees and turns him on. We're also talking about most African men like, shapes.
It leads me to my next question, where I want to ask you that aside the medical, the neurons and the hormonal and all you spoke about, what are the other conditions that will cause a dysfunction, a sexual dysfunction?
Very good.
Yeah.
So we are talking about a complex issues here, and none of these things can be mentioned without going into the psychoneuro aspect of the problem. Of course, there are psychosocial, socioeconomic aspect, etc. But it all starts from the being, the biology. And the biology is what I am seeing, first of all. If I see what I want in a woman, some like long legs, some like thin legs, some like big legs, some like big shapes, figures and whatnot. So when you give him what you want to see, the excitement starts right from there. And I have met a couple once upon a time who the man will just pounce them. If he said, in fact, my man was like an animal in bed. So like an animal, we are talking about somebody who can just do anything. And of course, when it comes to sex, you just have to do anything to bring satisfaction. Once the other party also understands what you're doing, and once you're not forcing the person into doing something you only want to do, then that is okay, it's fair.
Okay.
And sex is just about fair play as well.
Okay.
So, therefore, the man should think about all these things. When you see what you want to see, and she also sees what she wants to see in you. You see what I'm saying? Because if I've got too much of certain things that a woman doesn't want to see, it turns her off, right from the scratch. And the same way, if I see something in a woman and I'm not happy with, of course it can turn me off.
Okay.
We say that our clothing is just a big covering over a whole lot of things. But everybody, and that is how nature is so wonderful, that everybody has what they want. And one man's meat is, as they say, is one man's poison. So, sight is very important, the sense of seeing. And when it comes to sex, everything, all the senses play some role. In fact, it's one of the activities of human beings that involves
all the five senses.
All the five senses. I see what I want to see, then my brain start talking to the rest of my body, chemicals start flowing.
All right, Doc. Messages and questions have started running in quickly, and I would like to do a few of them, tackle a bit of them, and then we'll go to my next question, where I wanted to ask that. How does religion come to play in this as well?
That's right.
Okay, so now this one says that his Tiumbi from Yendi, please, can pains on my back muscles as well as waist muscles affect my sexual life?
Good. Yes, it does, because you see the waist problem sometimes or most of the time actually comes from a problem, something to do with the spinal health, your backbone.
Okay.
Most, when you take about 6 or 7 out of 10 problems that occur in the waist area actually occur as a result of a problem within something we call the lumbar coccygeal region of the spine, or the spinal vertebrae. So waist problem, yes, because you see there are centers. In fact, there is a center within the line, your spine, the backbone, that actually corresponds directly with the penis, or the reproductive organ. So therefore, yes, if the back or the waist problem is not anything to do with kidney problem, which can also cause waist problems as well. If that's got nothing to do with kidney, which in itself can even cause sexual dysfunction anyway. But the spine play a very major role.
Okay.
Why? Because we have the wires or the nerves all over. The bundles of the nerves are all over the backbone or the spine.
Okay.
And those things, right from the brain, they transmit, they send information to the peripheral nervous system, which also have a lot to do with your
So he should check it.
So first of all, we will advise this gentleman to try and do a check on the spine first.
Okay.
And the other thing is something to do with the kidney as well. So they have to find out what is happening, because that can also have an effect on the activity.
Now, the next one says that she doesn't want me to mention her name and where she's from, but she says that she wants to find out. She's 47 years old. She's still menstruating. Can she have a baby?
It is possible if she still have. Now I have helped someone, not up to that age, but I believe I've helped someone at the age of 45 years, because I deal with fertility issues as well. I've helped many people with fertility in London, and even here in Ghana, I've helped someone. So yes, 47, if the person is still menstruating. And the hormones, go back to the hormones again, the hormones are well balanced. They're balanced in the ratios that can allow these things to happen, then of course it can happen. Then the next thing we are talking about, we can also raise here, is as to whether the internal structures such as the uterus or the womb and the fallopian tubes and the ovaries are working. Those are also, the anatomy is also very, very important when it comes to these things. So it's not just necessarily about whether the person is menstruating or not. There are other things. But women don't just get pregnant. It involves a whole lot of things. There's a complexity to all these things. So it's not that simple. But then again, the lady can call me after this program.
And you're going to give your number.
I'll give them definitely. And then we will take it from there.
All right, we want to make it interactive as well on the phone lines. We're having the messages, and then we want you to call in as well. So the number to call into is 0302 770 222, 0302 770 222. For the last time, 0302 770 222. Doc is here to answer all your questions, and he just give the best and right answer you need to have. Now, Doc, this one says that good morning, doctor. I'm facing a very serious problem with my wife. We have been married for about 3 years now, and still we have no child yet. We always have problems in having sex due to dry nature of my wife's organ. I want to find out from you, doctor, could that be because of the delay of us having a child?
It depends also on the age of the two of them, because the age also play a very major role, especially with regards to the woman. If she's having a dry vagina, if I'm allowed to say this, if she's having a dry vagina, I mean, there is a problem. It could be so many of them, but one of them, which I will mention again, is the hormones. When it comes to sex, it's a cycle. Now,
and they need your number as well. So
cycle, neuroendocrine problems. It's a lot of things. So first of all, when you, at any point in your life, when you begin to realize you are having sexual dysfunction or problems with sex, please don't sit down.
What are some of the symptoms that would occur for me to see that I've started having sexual dysfunction? You hold on to that. We have a call on the line. Hi, good morning.
Good morning.
Hello.
Hello.
Good morning.
Morning.
And please, your name and where you're calling from?
I'm calling from Qatar.
From Qatar?
Yes.
And the name is? Gifty.
Yes.
All right, please go ahead.
Yeah, I have a problem with my husband. We're married for 13 years.
13. Okay.
Yeah.
She what?
Right.
I was married for 13 years.
She's been married for 13 years.
Okay.
On this morning. It's the problem I have in the house, right? My man cannot just leave. When he gets that stuff after with that, then he's done.
Okay.
So we can't have this. And it's time to go to hospital.
Okay. if I got it correctly, they've been married. They're married for 13 years.
Okay.
But the husband cannot ejaculate for long, so they've not had it's not giving them the opportunity to have a child. How would you address that?
Okay, first of all, ejaculate, meaning that she is discharging sperms, and if she's actually discharging sperms, if that is what I'm also getting it now, if that's what she means, that he's actually discharging the sperm, it has to be discharged anyway. If sperm is being, or the semen or whatever it is being discharged, all right, and they are not having a child, unless otherwise she's actually saying that he's not actually discharging the fluid, the sperm.
I heard that he was not ejaculating. That's what she said.
He's not ejaculating.
Yes.
He's not giving the fluid out. Put it that way.
Put it that way, yes.
Put it that way.
Yes.
Okay. If that is the case, then I wonder why they've sat over this issue for this long. Because you see.
Okay. Please hold on. Yeah. Hello.
Hello, good morning.
Good morning, how are you?
I'm fine.
Okay, your name and where you're calling from?
I'm Asantua. I'm calling from Tekedi.
Okay, please, Asantua, go ahead.
Yeah, please, I would like to ask. I have a problem with my husband. It takes long before he ejaculates. And sometimes it just goes. In the middle of the process, it will just go and it will take time before it will come back.
Okay. Okay. Doctor will help you on that one. Yes, doctor.
That should be a big punishment to her, isn't it?
You know, because in the middle of all the excitement. And then it goes.
Exactly. Yes, so it means that his erection is okay. He can go on. Is that what I'm...
It can go, but then in the middle of it, then it goes.
It just switched off completely.
It switches off.
No, it's a problem. It's a problem, but you see, like what we were saying, I mean, when I explained earlier on, in Africa, especially in our country, Ghana here, these things seem to be, there's a cultural inhibition, there's a cultural issue about talking about these things.
Yeah.
Many people are hiding because you were going to talk about religion, and I'll bring it in right now.
Yes.
Many people won't talk about these things because religion doesn't allow that.
No.
And we try to say that it is wrong for you even to go out there and say anything about sex. So people have kept this thing in, and they are there suffering.
Do our churches have a role to play in this?
They have to. They actually have to, because once they get to...
Sorry for your thoughts. We're having a lot of calls coming in. Hello, good morning.
Yeah, good morning.
Your name and where you calling from, sir?
Yeah, I'm calling from Gambaga. My name is Prince.
Your name is?
Yes, so please, I want to ask Dr. Harvey. Hello?
Yeah, please go ahead.
Yes, I want to put a question to Doc. I've married for 3 years now.
Okay.
I've discharged all right. My wife has a message all right.
Okay.
Everything all right. For about 3 months, years now, we have not had a child.
Okay. Right. His problem is that they've been married for 3 years. He has erectile functions fine. He discharges. His wife menstruates normally, regularly, but they don't have a child. 3 years.
3 years, okay. Has he had a child himself before?
No.
Because we need to talk about fertility issues. We need to know whether we are talking about primary fertility or secondary fertility.
Can we? Is it right to juxtapose fertility with sexual dysfunction?
Oh yes, because they all come under one umbrella. So if someone is active and it's healthy,
but if I can have a good function, okay, but then I'm not fertile.
Yes.
What would you say about that?
So what is fertility then? Fertility has a lot, and when it comes to men, fertility has a lot to do with the sperm quality.
Okay. So what would you tell that couple?
In actual fact, I would tell the couple to actually, first of all, if it is a primary problem, we want to know whether the man has had a child before or not. Whether the woman has had a child before she met the gentleman or not. We have to know the two.
If they don't?
If they haven't had a child, then it's a primary fertility problem.
Okay.
First, we have to check the man's. If he calls me after the program, I can do a test on him to check whether his sperm is good enough.
Okay.
Whether the numbers, because we are talking about sperm numbers.
Sorry, Doc, I'm very sorry. The lines are buzzing. Hi, good morning.
Good morning.
Your name and where you calling from?
I am Sewa and I'm calling from Nwa.
All right, Sawa, please go ahead.
Please, I have missed my period for January and up to now starting come. I did the test tube and it was negative. I went to do scan, it was negative. What could it be?
You hear that?
If she hasn't had a period, if you haven't had your period for how many
From
months?
January.
From January to now.
Yeah.
And she's tested negative to pregnancy.
Yeah.
What can happen is
And that scan and everything is negative.
fine.
Yeah.
Then it could just simply be ovarian problem. Ovarian problem. The ovaries may be playing up,
Okay.
and that can
The
also
human body is so complex.
very, very complex. The ovary can be playing up, or any of those things. In fact, something called fibroid or myomas.
Okay.
They are becoming very. In fact, some of the most tests I've done recently for women in Ghana here actually show some form of ovarian, some form of ovarian failure, ovarian cyst, or fibroid. And I don't understand. I'm trying to work out what is going on, but it all comes down to psycho, neuro, endocrine again problem. It is just about these things. The endocrine aspect is very important when it comes to things like menses.
Once again, sorry, Doc. Once again, sorry for cutting your thoughts. We have a caller on the line. Hi, good morning.
Good morning.
Your name and where you calling from, sir?
My name is Martin. I'm with my wife here.
Okay, please go ahead.
Yes, 49. I still menstruate. So she's asking, can she get pregnant?
Okay. It also depends on whether the ovaries are working. So the anatomy is very important when it comes to this. The biology is very important. If the if the ovaries are working, if the fallopian tubes that carry the sperm to meet.
Doc, to make it very simple
Yes.
for some of the viewers who are watching,
Okay.
Some of them are asking very direct, straight questions.
Okay.
I'm 49, I can't give birth, blah, 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 blah. Can you give them straight answers?
No, they are not. They're not that straightforward.
Okay, so you need to explain it to them.
We have to explain. We have to explain the science behind all these things.
Okay.
There's a science behind. In fact,
Yeah,
these
there's a
issues
science
are
behind
very
it.
big scientific.
How about those
questions.
who believe in herbal medicine?
Well, first of all, if you do, because we actually.
I'm sorry. I'm very sorry. I'm very, very sorry. Well, caller. Hello.
Yes, hello.
Good morning.
Morning.
And your name and where you calling from, sir?
I'm Emmanuel.
Okay.
I'm calling from Kwabi.
Okay, please go ahead, sir.
Okay. My problem is that when I ejaculate, within 1 minute, it comes down.
Okay.
Within 1 to 2 minutes, then it just drops.
You hear that?
When he
ejaculates, within a minute or two, it drops. It goes like there's light off. It goes off.
that is when he
Ejaculates.
No,
When he gets erected,
very.
within a minute or two, it goes down.
So if I get this question clear,
Yes.
is he actually having erection at all?
He does, but
And
in a
how
minute
long
or two,
does
he
it
goes.
stay?
A minute or two.
Then the erection
goes
Are we
down.
talking about ejaculation or erection?
What is ejaculation? What is erection?
Thank you very much. Erection is when the manhood becomes hard.
So when it's hard,
When it
that is
becomes
erection.
hard, that's
And which
erection.
one is ejaculation?
Ejaculation is when you are releasing
When the
sperm.
sperms come out, that's ejaculation.
That is when you are getting rid of the sperm from your.
It is good you
your
clear
manhood.
this, because people think that when you ejaculate is when you are hard.
Yeah, no.
But that's not it.
Because that's what I was trying to get clear over there.
Okay.
Because I didn't understand
Okay,
what
so
you
now
were
when they
saying.
call, we're going to ask them that. Because
Yeah.
is it that you don't ejaculate, or is that it's just...
That's what I was trying to. Because you
it.
see, there's a world of difference between the two.
It's so different.
So ejaculation actually is when you are releasing the sperm from the manhood up to the penis or those structures. And then the erection is when the blood pumped from your heart has actually filled the penile tissue.
Yeah.
And that comes with another complexity we're talking
does.
about.
It does.
Because, the penis, as you say it, I don't want to give the gross anatomy of
no.
it. But then I'm going to tell you that it contains some nerves, penile nerves. It contains, and then, some arterioles. Arterioles are vessels, blood vessels that run from the cardiovascular system. So arterioles actually are one of the smaller vessels that, because so if you get it right, you can only get it right when the tissues, the penile nerves, the nerves, the arteries, the veins, everything is working very well within the penis before it goes well.
All right, we have another call. Looks like the penis looks like a robot on its own. It has so many
very many structures within there.
All right, good morning.
Good morning.
Your name and where calling from, sir?
I'm Jerry calling from Kwando.
All right, please go ahead, Jerry.
Yeah, I have a little problem with the program because when people ask questions, I think that you should give a time for some time so that when they ask the question, so that doctor can explain the whole thing. Because when doctor is about to explain, then someone call in, so we don't explain about the question that they ask. That's my problem.
All right.
And people don't know the difference between ejaculation and erection. Erection, so I think
that's a good one. That's a good one. Thank you, Jerry. Thank you. Well taken. Well noted. Okay. All right.
So what we are talking about here, you see, when you want to understand some of these things, you need to understand even the structures we have. The penis actually contains a lot of blood vessels. Put it that way. Blood vessels that actually bring blood into the penis to fill the penile tissue in order to give you the erection. For this to happen properly and effectively and efficiently, three things. We need to have the heart to be performing its natural function very well. If the heart is not actually working well, which most of the time is the case, then of course pumping action of the heart will give rise to dysfunction. If the heart cardiac function is bad, and the vessels is also the next one. If the vessels are not actually dilating, especially people with high blood pressure, people with diabetes, if the people are having this condition,
Doc, sorry. Sorry. We'll have to take a call up. And hello, good morning. I thought we lost a caller. Now, those who like the herbal medicine.
Good.
Most of these herbal medicine, you don't go through the normal, they scan and they go through this, and some do, some don't. So those who go there, are they not helping themselves? They're not.
Yeah, the point
because
is,
with what you're telling us, it means these things really need a lot of medical scanning, screening,
it is
and
a medical thing. It's a very serious medical issue. You must know a lot about sex, reproductive biology, sex making chemistry, a whole lot of things. You see, because like I said, it's not that straightforward.
Are there special foods for this?
Well,
can one be on some kind of special diet?
Well, we say that to be sexually healthy, the whole body must be healthy. So you could be taking. People are talking about. We've actually seen research talking about lots of seafood, for instance, which is okay. I have actually read much about that. Seafood is fine. Shrimps and all those stuff actually help very much. But first of all, you see, you asked a question about the herbal medicine. You see, I don't know. Although I did integrative medicine, I learned a bit about the natural medical stuff as well as the conventional medical sciences. What I don't know much about is what kind of medicines they use in the herbal side to be actually causing any, to solve any of these problems. But brothers and sisters, if you're listening, which is very, and if you're watching, you must remember this before you even make any attempt to see somebody. First of all,
please hold on to that advice. Hold on to that advice. Let me take this call up. Hi, good morning.
Good morning.
Your name and where you calling from, sir?
Hello.
Hello.
Good morning.
Hello.
Hello.
Yeah, your name, sir?
This is Salifu from Yendi.
All right, Salifu, please go ahead.
Please, doctor. I wanted to find out something. Can pain on the lower back and together with the weak muscle affect one's sexual life?
He was the one you answered.
Oh yes, I answered that earlier on. It's actually, it has a lot. It can have a lot to do with it because in that area, if I know whether whether you are talking about the lumbar coccygeal region, there is a certain area within the anatomy which actually connects to your reproductive system.
So it can affect it.
So it can affect it. So yes, the answer to the question is it can. But first of all, self-diagnosis is a big issue here in Africa. and I don't blame people, because the rising cost of healthcare and everything has led to the point where many people decide to just diagnose themselves and think that, oh, if this is happening to me, it means this is going on, therefore I should do this myself. Self-care, that can be very dangerous. Yes, what the gentleman is saying, it could just be a very simple issue. And if this gentleman can talk to me about the program, I might be able to sort of advise him what to do, what to take, what not to take. Because you see, if you jump the gun and go straight to looking for the help, and go to places where the help is not even there, they don't themselves even have a clue. When it comes to these things, please do not be taking things anyhow, rampantly, irrationally, anyhow. Just don't take things. Don't take stuff, because you might end up killing the penis itself or killing the...
Yeah, we have some pics on the screens of some of the things people take and yeah, with some of these problems.
Exactly. Yeah. And people are even going to the extent of going to corner shops, small places where some people who we don't even know where they come from.
People take aphrodisiacs and all that for sexual problems.
Yes.
Is that right?
Right. Aphrodisiac, if I have to define it, is any medicinal substance or any substance that one can take. Sorry.
Does it enhance something?
That enhances, erection in a man and clitoral erection in a woman, or excitement. That is what they claim it does. Okay. Certain medications that are known to doctors through research.
We're still seeing some pictures on the screen.
Exactly. Can cause certain excitement. But then again, we are talking about psychoneuroendocrine, psycho, neural nerves, and then endocrine, the hormones. So if you are going to give me like some alcoholic beverage that contains something, and you say that thing can change everything. All these things I've told you, they're not simple. For anyone to say that, just give me this, let me drink right now, and you will see me jumping like a lion, going to pounce on.
People have been taking tiger nuts and all that. They think, you take all this and it helps you.
Simple like that. Because what most men can get, or most women can get from some of these so-called aphrodisiacs are some erection, some form of erection. And that if that thing actually contains a Viagra-like substance, then of course it might give some form of erection, some certain level of erection, certain level of erection.
Doc, can erectile dysfunction issues, problems be treated?
It can be treated.
If detected early, or?
Of course, if detected early. And if you don't go round and be buying some of the stuff that we saw on the screen, if you don't go round, because I've seen people carrying heavy load of things and they meet people and say, I'll give you this. I've seen someone, I was going to the ministries, and I saw someone who just came to our car and just told us, oh, I got this. When you take it, like this, she herself didn't even understand what she was saying. No, I wouldn't buy something from someone who doesn't even understand what a person is talking about.
And we can also treat ejaculation problems, right?
We can. All these things can be treated, but first of all, why is the problem there in the first place? We need to understand why all of a sudden, you may be with your wife for years, and all of a sudden, you don't get erection at all. What is causing that? We need to understand, if it is a psychological problem, we need to solve it through psychotherapy.
Doc, we're going to let you give your number very soon. I just want to take, there's so many messages. I'm going to take only 3 messages, but let me just take 5. And then go to Doctor, give his final word, his telephone number, and we're out of here with this one. Now, it says that, good morning, please help me, Dr. Richard EGHAN. I need Dr. EGHAN's number. I'm in need. Now, he's speaking about sexual dysfunction, and I want to discuss with him on the topic of sexual dysfunction. He wants to go further into this topic.
That's good. That'll be fun.
And then this one says that, wow. He sends the same messages, about 30 of it. Now it says, hi Doc, I have this problem when it comes to sexual intercourse. I sometimes lose my erection when having sexual intercourse with my wife. At times, I will not even insert my penis into a vagina, and I lose my erection. But when I rather meet someone else who is not my wife, and I'm trying to do galamsey, why should you do galamsey when you have a wife?
Exactly.
I don't experience such problems.
Yes, that's...
I don't think you should even answer this.
No, I have to answer this question. Because
he doesn't
And you know why? Because there's a psychological aspect to that. You know, there's a gentleman that came to see me in my clinic in London. This person actually couldn't have sex with a wife in London. When it comes here, his girlfriend gives him very good sex. He actually enjoys sex with a girlfriend. There is psychology here. So if someone is telling me that, well, I can give you this and it can solve what? Psychological problem as well? Okay. So we need to treat the person from head to toe. Okay.
Let me do 2 more minutes. I need to wrap up with this discussion.
Yeah,
it says I have been diagnosed with cervical and lumbar stenosis.
Good.
Therefore, I don't feel for sex. Help me, please. My name is Jonas.
You take my number.
Yeah, take his number.
You have to help because that stenosis problem is a big thing. Yeah. And we need to actually find a solution to the problem. Okay. It is not just a matter of just going to buy some herbs and just drink it and think that, because like I said, that's why I gave the definition. My definition to these things is not just a simple thing, I said complexity. Yeah. And it comes right from the brain, it goes down to your nerves, it goes down to the chemistry have to be right. Okay. So therefore, if you are a woman and you've lived with a man for a long time, you are not having a baby, it could well be, even if you are menstruating, it could well be that your hormones are still not good. It could well be the internal structures are not very good.
We can't answer all the 1,001 questions out here. But you're going to give your number and they're going to call you, and please, doc, help them. How expensive are you?
Oh, no, very
okay, all right. Now, the last one says that, good morning, Mr. Host. Beautiful program, beautiful show, GTV. Doctor, please, I don't get erected at all. What should I do? My name is Yakubu Nado from Nadoli Adwa.
Mr. Yakubu, you have what we call erectile dysfunction. Okay. That is also an aspect of the sexual dysfunction.
So, Doc, give us your number. Where can they get you?
All right. My numbers are 0559 46 5247 0559 46 5247. Another number is 0246 82 6256 0246 82 6256. The third one is 0557 38 9454 0557 38 9454. If you call these numbers right now, especially the 0559 46 5247 and the other one 0246 82 6256. If you call now, somebody will be taking your calls, and you can explain things to them. They will pass the message on to me as I'm here now, and I'll call you back, or you can call me back. When you call me now, you don't get me, please call me back anytime, in the night, in the morning, anytime. I'm here to help you, because I have seen from the statistics I have gained that many people have this problem over here. Like I said before, not only men, but with women as well. If you take about 10 people, 10 men, you have about 8 of them that have one form of sexual dysfunction or the other. And the same statistics goes for our sisters as well. They also have it. If you have a wife that is not responding to you in terms of sex, please do not think that there's something going wrong. If you have also a husband that is not doing it at all, sit down and communicate about it. There may be a problem. That problem cannot be solved just by going to buy any alcohol-based kind of thing. I wouldn't say go into these things, but please, it is just about the entire body. If you can get erection and you don't get excitement or the drive, and you can only do sex when you actually drink some alcohol-based something or some herbs that somebody's talking about, you can only do sex based on that. Okay. Then you have a problem. Okay. But if we can solve your problem by going into your cycle, and then the nerves, the brain, and then
we need to go. Can I have the other number again?
Yes, I'll give the number the last time, and then we go.
Yeah, we need to go.
It's 00.
You can hold it. You can. Yeah.
So it's 0559 46 5247 0559 46 5247 0246 826256 0246 826256 and 0557 389454, 0557 389454.
All right.
The clinic is Nature's Green Medical Center. If you call me, I will show you where you can find me.
All right.
And come, let's solve the problem in a proper way, in a medical way.
Where's it located?
It's located around the West Hill Shopping Mall, along the Accra Kasua Road, near a place called SCC.
Right.
So we are talking about the vicinity where you find the West Hill Shopping Mall.
I mean, this is a social problem. It's a social issue.
It's a big issue.
Eating into the family. And if the family is unhealthy, things can't go on. Institutions and organizations can't go on.
Many marriages are breaking down because of these
A lot of
things.
marriages are breaking up.
A lot of them.
A lot. Okay.
So
this has been a very good discussion. Thank you so much for all of you who called in, you phoned in, all the 1,001 messages. Doctor is going to see to this. Call him. And once again, just do 2 of his number: 0559 465247, 0557 389 454. Calling, and you're going to get seen to, and it's going to give you all the advice you need. And no, I want to say thank you so much.
Thank you
very much.
Me here.
I'm sure we'll have another platform for this again.
So, this one is a long thing.
It
so
is.
We need to
It is a whole day's discussion. All right. So coming up next, we have the paper review segment. You don't want to miss that as well. Stay on. You're switching on to the Breakfast Show.